Are you now reconsidering your position when it comes to single-payer health care?
Millions of Americans continue to lose their job, which means that many of those Americans are also losing their health insurance that they had through their employer. Despite all of this, Joe Biden still does not support Medicare for all. So I'm going to show you the clip of him discussing this on MSNBC. I'm also going to go into why Joe Biden is wrong, and I'm also going to explain why his healthcare plan would not solve this problem either. So first, here is his appearance on MSNBC where he discusses why he doesn't support Medicare for all still.
As you've been seeing, our healthcare system seems to be crumbling underneath this crisis. There is not enough. There's not enough support for the healthcare system. There's not enough support for the American people inside of the healthcare system. Are you now reconsidering your position when it comes to single-payer healthcare?
Single payer will not solve that at all. The thing that is needed is, for example, we have a whole number of hospitals that are being so stretched, including rural hospitals, they're going to need more financing. That doesn't come from a single payer system. That comes from the federal government stepping up and dealing with the concerns that they have, the reimbursement that they're going to get, how they're going to be able to move forward, and how they're going to be able to provide all the needed help that are needed in their communities. This is an opportunity to look at reconstructing the healthcare system in a way that, in fact, can respond more rapidly and more effectively to these kinds of crises.
All right, this is this is amazing. It's amazing because he goes on. He essentially says here, I'm half quoting him, but this is what he says in his sentence: they're being stretched, including rural hospitals. They're going to need more financing. Comes from the federal government. Yeah, the financing that they need comes from the federal government. In a single payer system, the federal government is the single payer. I mean, how is this man about to be the Democratic nominee? And how is the media not pressing him on how ridiculous this answer is? So let me show you the reality when it comes to rural healthcare and what would actually help them. So first, go to The Guardian here. This was an article back in 2019 from Barb Callback. For rural America, Medicare for all is a matter of life or death. So there's a piece I want to read, a paragraph I want to read from this. There are many reasons rural hospitals are hurting, but for-profit insurance companies are the nail in the coffin. Over decades, these multi-billion-dollar companies have driven premium costs up and put profits over patients. More and more patients can't afford insurance and can't pay their hospital bills, leaving rural hospitals and hospitals in low-income areas left holding the bag. So what's the solution? Medicare for all. Let me go into more detail here. From this piece from The Hill. This was posted this month, March 11th, 2020. 453 rural hospitals are failing. Medicare for all would save them. In congressional testimony, Dr. Jessica Banthin, Deputy Assistant Director for Health, Retirement, and Long-Term Analysis at the Congressional Budget Office, explains that enacting single-payer Medicare for all could keep rural hospitals afloat. Everyone would have good coverage, and hospitals would be compensated at Medicare rates, or better, for the care that they deliver. More here. Because rural hospitals are not reimbursed for much of the care they deliver, many of them cannot generate the revenue needed to serve their communities. Nearly 4 in 10 rural hospitals are unprofitable. Low patient numbers contribute to the problem. Hospitals are cutting services and closing. Rural Americans sometimes must travel 30 miles to the nearest hospital. Before I read the last paragraph here that I want to get to, this shows you the issue here. When you make healthcare a for-profit industry, well, what happens in these rural areas where not many people live? People still get sick, oftentimes get even more sick because of the situations that they're in. And because healthcare is a for-profit system, well, obviously these hospitals, these healthcare providers aren't going to make money in these rural communities. So a lot of them end up shutting down. But under a Medicare for all system where you take out the for-profit aspect of healthcare, then you're able to actually properly serve these rural communities, these more poor communities. One more quote here from this piece. So with Medicare for all, Congress would ensure the viability of rural hospitals. Rural hospitals would be properly compensated for the care they deliver, strengthening their balance sheets. Medicare for All's guaranteed health care coverage would ensure that rural Americans could get the health care they need without fear of medical debt. Medicare for All eliminates deductibles and coinsurance, treating rich and poor equally instead of rationing care based on ability to pay. So this is a great point as well. Oftentimes you'll hear an argument, from conservatives that, in these universal systems, in these single payer systems, there's rationing. You have to ration care because there's not enough doctors for everybody, so you got to ration the care. There's also rationing in America. But the rationing in the U.S. is based on cost, is based on wealth. If you can afford healthcare, then healthcare in America is great. If you're super rich, American healthcare is fantastic. But if you're most people, you can't afford it. It is not good. So there is still rationing in the American system, but rationing is based on wealth, as opposed to other systems, universal systems, where rationing is based on need. There's rationing in healthcare regardless of any system, because there is not an infinite amount of hospitals and doctors. At some point, you have to ration care. More here. So, on the idea that Joe Biden's plan of a public option, that somehow would be the solution. In reality, a public option would actually potentially make things worse. So this is based on, this article is based on a Yale School of Public Health study from author Alison Galvani. So I want to read a piece of this here. So Mayor Pete Buttigieg, former Vice President Joe Biden, Senator Amy Klobuchar, and billionaire Tom Steyer have argued that Americans should be able to keep their private insurance while there also should be a public option to buy into Medicare. Before I go any further, look how dated this article now looks. People should be able to keep their health insurance. Well, this was posted, I think, a couple months ago. How does that sound now? When millions of people are losing their job, kicked off the health insurance that they had through their employer. Doesn't make much sense anymore now, does it? But going on here, Buttigieg has dubbed his plan Medicare for All Who Want It. Buttigieg's plan, Galvani argued, would actually increase costs, not reduce them. Without the savings to overhead, pharmaceutical costs, hospital clinical fees, and fraud detection, Medicare for All Who Want It could annually cost $175 billion more than the status quo. That's over $600 billion more than Medicare for All. So a public option would actually make things worse than the status quo. Because what happens is you still enable these for-profit companies to continue making money off people. And then what can they do? They can offset all the sick people onto the public system. Drain the public system of resources in the process. And now nobody on the public system gets proper help. Under a Medicare for All system, everybody would be on the same system. Your Congress people on the same system as you. The wealthiest people in the country on the same healthcare system as you are. And in doing that, how bad do you think the healthcare is really going to be when the richest people in the country are going to have the exact same healthcare that you do? Your Congress people, exact same healthcare as you do. Endless benefits to a Medicare for All system. One more piece that I didn't include in my links here, but I want to mention it. There's this discussion of COBRA. Well, if you're kicked off your health insurance from your private, if you lose your job, but you want to be able to buy into your existing healthcare coverage that you had through your employer, well, there's COBRA where you can pay into it and then it all works out. Well, the reality is it is incredibly expensive to be able to stay on your existing plan if you lose your job and you want to keep your health insurance. So let me actually find the quote here from Vox and I'll show you exactly what I'm talking about. All right, so this is what I'm talking about. So this from Vox. There is COBRA, though it is increasingly obsolete since the ACA became law. COBRA allows people to continue buying into their existing health plan even after they've been laid off. they could be required to pay the full premium with no help from their old employer, which is exorbitantly expensive, $7,200 for an individual and more than $20,000 for a family on average. So even if you have this option, the idea that you're now out of work during this crisis, clearly you're going to have a really hard time finding a job right now. How are you going to pay this? So under a Medicare for all system, you wouldn't have to worry about cost at all. None of this. As a Canadian, I get this. I never think about the cost of healthcare because I never have to think about it. The one thing that keeps me sane through this entire crisis right now is that I know if I need healthcare, at the very least, I won't have to think about how much is that going to cost? How much is treatment going to cost? And what's funny as well, you're seeing politicians now like Kamala Harris say, oh, treatment has to be covered for this virus. If you have this virus, treatment must be covered. Okay, I agree, but why do people with cancer have to pay? Why do people with other illnesses, why do they have to pay? Why is it perfectly okay for them to have to pay, but only for this virus? If you have this virus, oh, you shouldn't have to worry about it. How does that make any sense? Like, the mask is off. It is obvious these politicians are simply fighting for the existing system to continue, fighting for this for-profit system to continue because they currently benefit. Their campaigns benefit from the current system, from donations, from support, from people in the for-profit healthcare industry. There is no other reason to defend this ridiculous, rigged healthcare system.